The penile prosthesis is a great option for guys who want to have spontaneous erections and erections that are firm that they can use for as long as they want. Most patients who come to me and opt for a penile prosthesis have tried other treatments which have not worked for them. So they've tried medications, they've tried injections, and they're frustrated with either the outcome or the need to take a pill or do an injection every time they want to have sex. Other guys will come and they have read about the implant and just really want to go that option because they've heard that the satisfaction for patients is high. But again, I tailor that to you and what your goals are so that we can make an informed decision together. During the procedure, you're asleep. There's full anesthesia, so you don't feel or remember anything. I'm putting the device in through that incision in the scrotum that I make, where I'm making it a cut in the penile bodies or the erectile tissue that's in your penis, and I replace that erectile tissue with these cylinders. That's necessary for us to do this measurement, as well as the placement of all the elements of the prosthesis. And it doesn't take all that long, somewhere between 60 and 90 minutes for the whole procedure. So it's relatively quick, and the aftercare is relatively easy, although as we talked about, you're a little bit sore. But nothing crazy is happening during the procedure. We're just implanting the device into the normal tissue planes that you already have. For the penile implant, the preoperative clearance really varies based on your medical comorbidities or other medical issues that you have. For some guys who are relatively healthy, all it takes is going to see your primary care physician for clearance. If you have some more complex medical issues like diabetes, a history of heart issues like heart stents or heart attacks, I would have you see an anesthesiologist leading up to surgery so that they can clear you to make sure that we have you in the safest environment during your surgery. But overall, it takes maybe a few labs and another visit, and we can clear you for this surgery. Because you're undergoing anesthesia where you're asleep, you do need to have a ride home afterwards. We would also recommend that you have someone stay with you after the procedure at home overnight, just because things can happen after anesthesia and it's best if someone is looking after you. The nice part about this procedure is that it's a day surgery, which means you go home the same day. You can just sleep in your own bed, but because of the anesthesia, we do need you to have someone drive you home. There are some medications that I would want you to stop prior to the procedure. I would work with your primary care physician or a specialist who's prescribing those medications to stop them ahead of time and do it safely. Some specific medications that fall into that category would be blood thinners, like warfarin or Plavix, any anti-inflammatory medications for rheumatoid arthritis or kidney transplants we may have to alter. But in general, there are no medications that will stop you from getting this procedure. It's just something that I have to do ahead of time with your providers to make sure that it's safe. There are no restrictions leading up to midnight right before your procedure. So you can eat a normal meal the night of beforehand, but we don't want you eating anything after midnight or drinking anything after midnight prior to your procedure. That makes sure that when you go to sleep, the anesthesiologist has the safest environment to put a tube in to help you breathe during surgery. Anything that you eat after midnight can put you a little bit higher risk. So nothing that you have to stop eating leading up, but just nothing to eat or drink after midnight the night before. Because you're not staying overnight, just the things that you need for the day. There's no special clothing that you need. We will give you all of the bandages and a jock strap to go home with to wear on your way out. So just your normal clothes, your loved one, and anything that you would need the day of. I always tell patients to do exactly what you do on your normal basis. So if you're somebody that shaves your groin or your genitals, you can do that ahead of time. I would prefer that you don't do that leading up to the day of surgery within the most recent 3 to 5 days, just because if you cut anything down there, it can increase your risk for an infection. But certainly if you don't do anything on a regular basis, there's no reason to start. We will clean you up before surgery and make sure that it's all safe to go. The day of surgery is a pretty fast and ready day. Depending on which hospital you are having your surgery done at, We will have you come in either 2 hours before or 1 hour before your procedure. You get shown into a preoperative room. There's a nurse that places an IV and talks to you about surgery. You have an anesthesiologist come to talk to you about surgery and the risks of anesthesia and do a quick history. And then I see you before you go back to surgery to make sure that we're all ready to go and that you don't have any further questions. That goes by pretty quickly. It's that hour to 2 hours prior, and then we wheel you back to the operating room and get everything done. Typically don't remember a whole lot of rolling back to the operating room in the immediate post-operative period, but you have to stay around at least an hour after surgery to make sure that you're awake, everything's going well, your pain is under control before we send you home. Every procedure is a big procedure for the patients who are going through it. The best thing is to try and get as good of a night of sleep the night before. Make sure that you have all of your questions answered, and I'm always available to answer any questions last minute or leading up to surgery. But it's normal to be nervous, and that's something that we can help you with before and the day of surgery. The anesthesiologists are great at giving you some medications to help you calm down if you need it when you get to the arrival of the procedure the day of. But some level of nervousness is certainly normal. I would just reassure you that you're in good hands and we're going to take the best care of you, and that we will get through the surgery and get you on your way to being healthy and having a good quality of life. After you see me in clinic, I'm always available via my chart, so you can send me a message through that. Our nurses triage your messages, and sometimes they will answer it if it's an easy answer for them. Otherwise, they will send it through to me. If you have pressing questions leading up, you can always call the number to our triage nurses, which is on your after visit summary from your visit with me. There's always somebody available to answer your questions, and we can get back to you in a timely manner to answer those. Similarly, after surgery is the same. There's always somebody that's on call, whether it's a resident or a triage nurse, who can field your call and direct it to me or the appropriate party.